Street Health is an American healthcare network of primary care centers for older adults and disabled people with Medicare. Dr. Bridget Darr, their center medical director, is here today to discuss cognitive health. Hello, doctor.
Hello.
How are you?
I'm wonderful. Thank you for having me.
Yes, absolutely. Okay, so I've seen your signs when I have driven, and I understood that it was for older patients, but I always was curious, what is Oak Street Health?
Yes, so we are primary care for older adults, mainly people on Medicare. That's who we serve, that's who we take care of.
And so what makes you different from other medical offices? Like, what is your niche?
Well, it's really, we are solely focused on older adults. So a lot of primary care offices see anyone, babies to teens, to people in their mid-20s, 40s, etc. We solely focus on older adults, which gives us a unique perspective. We get really comfortable treating those things that tend to impact older adults more commonly than other groups.
Yes, and you're connected to a pharmacy because the location I'm thinking about in downtown has the CVS there. And then I also think I see a little sign that says like AARP is associated with it. Okay,
Yes.
So you all just kind of bring in a collective of medical partnerships that older folks need as they are aging. So talk to me a little bit more about the all-in-one stop option that they have.
Yes, so we have 2 locations here in Fort Wayne. The center that I'm at, we call Summit City. That's the name of our location.
Yeah.
We are connected to the CVS pharmacy. Now, if you go in there, it's not going to be your traditional CVS pharmacy. You're not going to see the birthday cards and the snacks and whatnot.
Right, the candy aisle that you don't need to go down.
No. But you will see, we have a have a handful of over-the-counter medications, vitamins, etc., and then they have the pharmacy.
Okay.
And what's really nice about that, I have quite a few patients who really like that, because if they come in and they need a prescription for whatever reason, I can send it right over. It may take 20 minutes, but they can hang out, grab a cup of coffee, wait for that prescription, and then leave, and they don't have to go back out.
Yeah.
Which is really nice.
It's such a convenience. Just, I have personally been at a medical practice before that was inside of a hospital. And so it's the same thing. They prescribe you something, you go downstairs, you wait just a moment, which is worth it because you don't have to drive and try to remember to pick it up later.
Absolutely.
So that's a really great benefit for our elders. So when we say elder adults, what age range?
So it gets a little fuzzy, I would say. I don't necessarily put a specific number on it. I do have a handful of patients who are a little bit younger, and then most of our patients, I would say, are 65 and older. But we have people who are younger who are on Medicare for various reasons.
Right, because that's the disability part in it. Okay, so let's focus on cognitive health a bit.
Yes.
Okay, what is cognitive health and why is that important for this age range?
Absolutely. Well, we know as we get older, cognitive health becomes more of a concern. And cognitive health is really our ability to think, learn, remember, do. It's really our ability to function. So that's obviously very critical for our day-to-day life. There are so many things that impact our cognitive health. I'm going to focus on 3 for right now.
Yeah.
Staying active, eating healthy, and learning. What do I mean by that? Well, first of all, I really like to say to my patients that what is good for the heart is good for the brain. We spend so much time talking about heart health that all of those things are going to benefit our brain. So eating right, fruits, vegetables, lean meats, the more we can do that, the better our cognitive health. The old adage, we are what we eat, is so true. When we fill our body with healthier foods, we think clearly, we have more energy, we're more active. When we put in those fatty, salty, sugary, highly processed foods, it actually weighs us down. We may not realize it at the time because it can feel so good.
Right. Feel so satisfied. It's like, how could this be wrong?
But if you do that day in, day out, it really does start to slow your reflexes, slow your mind. Staying active. same kind of thing. If you don't use it, you lose it. So it's really critical to move. And that can be challenging as we get older, but it's so important, whether it's walking, gardening, swimming, biking, dancing, listening to music. In fact, newer studies are coming out showing that dancing and listening to music actually can help prevent dementia.
Oh.
Because it uses so many different parts of our brain. It's such a good thing to do.
I love that, and that's fun. I mean, these are things, those are your top three, but they're fun things and important things.
Absolutely.
And we talk a lot about just the mental health era that we're in, especially when it comes to the epidemic of loneliness. And it's not just with young folks, middle folks, it's with all ages, but especially older people because they have maybe lost loved ones or lost their friends or spouses, because the older you get, unfortunately, that happens around you. So how does isolation affect cognitive health?
I think it absolutely does, and I think we really saw that, with COVID and some of the restrictions, and that was really hard for a lot of people. And it just highlights how important socialization is for us. So what does that look like? Because as you said, that can get challenging, but any kind of volunteer work, connecting with family, friends, grandkids, church groups, anything like that can really help you stay connected. And at Oak Street, we value that so much. We actually have dedicated space in all of our clinics. It's called a community room.
Okay.
And you can come in, grab a cup of coffee. We have puzzles, we have games, we have different activities, because the other part of cognitive health is keeping your mind engaged. So learning, Sudoku, trivia, Jeopardy, all of those things are going to help keep your brain sharp. So we have we don't have Jeopardy, but we have some of those puzzles and things in our community rooms. And we really encourage our patients to stop by, have that connection, meet the care team, because it's more than just me there.
And are you currently taking new patients?
We absolutely are.
Okay.
Yes.
Okay.
Yes.
Wonderful. Well, you have 2 locations in Fort Wayne. You're actively taking them, and there's a lot of stuff that it sounds like that you offer.
Absolutely, and that actually brings me to another point of a little bit more about Oak Street. So we are primary care, so we want to take care of the whole person. Your mental, we talked about, but your physical. That means, if you have high blood pressure, if you have diabetes, we want to get that under control. Why? Because if those things aren't controlled, that can impact your memory. Can lead to brain fog. So we want to be the one stop to take care of all of those things. Plus, the more we see you, the more we get to know you. We get to know your family, your values. As we see you over time, we can detect those small changes. Because memory loss can sometimes sneak up on us, and it can be hard to detect. But if we're seeing you regularly, we can detect that and then come up with a plan that works for you, for your family. We can bring in other members of our care team. We have social workers, we have counselors, we have nurses. We have a whole care team at Oak Street dedicated to you. A lot of our patients, they may struggle with vision loss or hearing loss. We can help you connect with those resources, because if you can't see or can't hear, that makes it hard to stay focused and maintain your memory.
Yeah. Oh, that's so good. Well, it sounds like it's a one-stop shop and what you all have to offer, and that's wonderful. So thank you so much for coming in, Doctor.
Thank you.
Sharing about your organization.
Yes.
And if you would like more information about Oak Street Health, we'll have their website listed below so you can check them out, and I'll see you after the break. This segment sponsored by Oak Street Health.